Imagine you're in a large group of people, like in a mall spending the day shopping with some friends or family. It is supposed to be a fun day for you all to enjoy, and all of a sudden, you see a person fall to the ground. You run over to help and realize that he or she has stopped breathing and has no heartbeat. You ask yourself, what do I do? Should I get help? Should I call 911? It can be quite a traumatic experience not knowing what to do in that situation. However, having a CPR training may help you in this situation and may save another person's life. Have you ever found yourself in this situation? I know I haven't, but if I found myself in need of using CPR on anyone, I know that I am prepared because of my CPR certification and training. When I was a sophomore in high school, our high school had a seminar on how to properly give CPR so that if anyone were in a dangerous situation, we would be able to help them. Today, I will be telling you about CPR, what to do before performing CPR, and how to properly give CPR to anyone who needs it. First, I want to share with you what CPR is. CPR stands for cardiopulmonary resuscitation, and it is an emergency life-saving procedure performed when the heart stops beating. It can be used in many situations, including a heart attack, drowning, no heartbeat, no breathing, etc. CPR helps keep oxygenated blood flowing to the brain and other vital organs, and it is used until more definitive medical treatment can restore a normal heartbeat. In order for CPR to be effective, it must be done immediately to the patient in order for no brain damage and to restore life. When you come across somebody in the situation of needing CPR, there are things to do before you start. First, you should check the scene to make sure it is safe for you, and then check the person by tapping him or her on the shoulder and shout, "Are you okay?" to make sure that he or she needs help. If he or she is not responding, either you call 911 or have someone around you call 911. Then ask another person to find an AED if available. If it isn't available, begin administering more assistance. Then lay the person on his, her, and her back. Tilt the head a little bit slightly to lift the chin so there can be an open airway. And finally, listen carefully for 10 seconds for breathing and gasps. If there is no sign of breathing, you should begin CPR. The American Red Cross Association has provided many steps to performing CPR properly. Usually they demonstrate this on a doll, but I have a pillow that I will be used to show compressions. First, place your hands on top of each other as so. Some people interlock them, some people lay it flat. But the most important thing is to lay your hands on top of each other and to set it in the middle of their chest and begin compressions. The compressions should be hard and fast. You should use your body weight to help administer the compressions. And they should be so hard that they should be at least 2 inches deep when you do these. You should do 30 compressions as so. And after you do 30, you should deliver rescue breaths. When you deliver rescue breaths, you should pinch your nose and shut it. Then place their mouth on your mouth and complete a seal between the two. When the seal is closed, blow into their mouth and make their chest rise. You should give 2 life-saving breaths. And if they still have not responded, continue with another set of 30 compressions and repeat. Continue to perform CPR with compression and breathing until there are signs of life, an AED is found and available, or a trained medical responder has arrived. Today, I have told you about what CPR is, what to do before CPR, and given you the steps on how to perform CPR properly. Although I have never had to use CPR, I know that I will be prepared to do so if somebody is in an emergency. I hope this demonstration urges you to get certification in CPR, because an emergency situation can happen at any time, and it is better to be prepared than not to when it comes to performing CPR. Thank you for watching.